You've likely heard the name Ozempic, surrounded by headlines and whispers of rapid change. Tonight, let's gently set those assumptions aside. As you drift off, we'll trace not just a medicine's path, but a deeper story of the body's own quiet rhythms. If you've ever felt that gentle, insistent pang of hunger, or noticed a subtle dip in your energy after a long stretch without food, you've been listening in on one of your body's oldest and most vital conversations. It's a dialogue that hums beneath our awareness, a constant, silent exchange of chemical messengers designed to maintain a delicate state of internal harmony. To understand a medicine like Ozempic, we must first listen closely to this natural conversation, to the biology of balance it seeks to support. So, let's settle in and explore this inner world together, where everything begins with a whisper from our gut. Deep within your digestive system, scattered like tiny islands of insight among the folds of your intestines, are specialized cells. They are quiet sentinels, perpetually monitoring the environment. When nutrients from a meal begin to arrive, these cells sense their presence, and in response, they release a messenger. This messenger is a hormone. Its name is GLP-1, which stands for glucagon-like peptide 1. Think of GLP-1 as a gentle, eloquent courier dispatched the moment nourishment is detected. Its job is to travel through your bloodstream and deliver urgent, important news to several key destinations within your body. The first message is for your pancreas. The pancreas is a diligent organ with a dual role, part of it dedicated to producing insulin. Insulin is the key that unlocks your body's cells, allowing sugar from your blood to enter and be used for energy. When the GLP-1 courier arrives at the pancreas, it whispers a clear instruction. It's time. Release insulin. And so, the pancreas responds, sending out just the right amount of insulin to gracefully usher that circulating blood sugar, what we call glucose, into your cells. This lowers the level of glucose in your blood, gently and efficiently. But the work of this humble hormone doesn't end there. GLP also has a message for your liver. Your liver acts as a careful reservoir, storing and releasing glucose as needed. To the liver, GLP-1 speaks a calming word of restraint. It asks the liver to pause, to hold back on releasing its stored glucose into the bloodstream. This double action, ushering sugar into cells while asking the liver to wait, creates a beautiful, balanced effect. It helps prevent those sharp, jarring spikes in blood sugar that can follow a meal. There is another, perhaps more personally familiar message that GLP-1 carries. This one is for your brain. Specifically, it travels to a region deeply involved in managing appetite and the sensation of fullness. When GLP-1 reaches this part of your brain, it delivers a quiet, soothing report. The report says, nourishment has arrived. You are satisfied. It's a signal that helps turn down the volume on hunger, promoting a feeling of calm fullness. It even slows down the journey of food through your stomach, a process called gastric emptying, allowing that feeling of satiety to linger a little longer. This, then, is the symphony of GLP-1. A single hormone coordinating a graceful response across multiple organs, the pancreas, the liver, the brain, all in the service of one goal: metabolic harmony. It manages blood sugar with precision and cultivates a gentle sense of contentment. For many people, this internal communication flows smoothly. The sentinel cells dispatch their couriers, the messages are received, and balance is maintained. But for some, this conversation can become faint or disordered. The sentinel cells might not be as responsive. Perhaps they release less GLP-1 than is needed, or the messages they send don't seem to be heard as clearly by the organs they're meant to reach. When this happens, that delicate harmony can begin to falter. Blood sugar levels may start to climb and remain elevated as the signal to produce insulin grows weaker. The feeling of fullness after eating might become fleeting, difficult to grasp. As the appetite-regulating signal in the brain loses its strength. It's not a failure, but rather a softening of this essential dialogue. The body's own elegant system for maintaining balance is speaking in a whisper when it needs a clear, steady voice. This is the quiet physiological puzzle that scientists and doctors pondered. How could they support this conversation? How could they reinforce the body's own inherent wisdom when its natural signals began to fade? The answer lay not in shouting over the body's own voice, but in learning its language and offering a supportive echo. A scientific echo designed to resonate with the same receptors that listen for the gentle whisper of natural GLP-1. It is here, at this gentle pivot from the body's innate, sometimes faltering, communication to the idea of a supportive companion, that our journey through the science finds a natural pause. Now, if we could gently turn our attention from the body's own subtle signals to the quiet ingenuity of a laboratory, we arrive at the heart of the story, the invention of the molecule itself. This is the moment where human curiosity sought to listen to that ancient hormonal whisper and to craft an echo so perfect it could speak to the body in its own language. The journey to create what we now know as Ozempic or Semaglutide began not with the search for weight loss, but with a profound respect for a natural process that had gone awry. Scientists looked closely at a hormone we briefly met earlier, GLP-1. They saw its elegant, fleeting dance, how it appeared just when needed, delivered its message of fullness and insulin release, and then dissolved away, almost like a note written on mist. The therapeutic challenge was beautiful in its simplicity. How could one preserve that gentle message and allow it to linger? The answer was a feat of molecular sculpture. Imagine a master jeweler studying a brilliant but fragile natural diamond. Their goal isn't to replace it with something artificial, but to carefully alter its structure, just a few atoms here and there, to make it more durable, without losing a single facet of its inherent beauty. This is what scientists did with semaglutide. They started with the fundamental blueprint of human GLP-1, that same sequence of amino acids our own cells produce. Then, with immense precision, they made two key changes. They attached a fatty acid chain to the molecule, a kind of molecular anchor, and they swapped out a single amino acid, a tiny adjustment in its architecture. These alterations were subtle, almost infinitesimal in the grand scheme of things, but their effect was transformative. That fatty acid anchor allows semaglutide to bind to albumin, the most abundant protein in our blood. Think of albumin as a bustling, gentle river constantly flowing through your bloodstream. By hitching a ride on this ubiquitous carrier, the semaglutide molecule is protected from the kidneys, which would otherwise filter it out and discard it quickly. It's given a passport to travel slowly and purposefully throughout the entire system. That single amino acid swap, meanwhile, makes the molecule resistant to the enzymes that would normally chop our natural GLP-1 into pieces within minutes. So, what was once a brief whisper becomes a sustained, quiet conversation. This elegant redesign solved the puzzle of duration. Our natural GLP-1 survives for perhaps 2 minutes. Semaglutide, through this gentle engineering, endures for about a week. This is the profound simplicity behind the once-weekly injection. It isn't a bombardment of the system. It's the establishment of a steady, reliable rhythm, a slow-release tide that mimics what a perfectly functioning gut might signal over many days. It's a testament to working with the body's logic, not against it. And it's important to remember the original purpose of this design. This molecule was crafted for the intricate management of type 2 diabetes. In that condition, the body's conversation about blood sugar is fraught with miscommunication. The pancreas may be slow to release insulin, the liver might overproduce sugar, and cells can become resistant to insulin's knock at the door. Semaglutide was designed to gently recalibrate this dialogue. By persistently activating the GLP-1 receptors, it encourages the pancreas to release insulin only when blood sugar is high, a more natural, on-demand response. It politely asks the liver to produce less sugar, and it slows the journey of food through the stomach, not as a side effect, but as a core part of its meditative message of satiety. For many living with diabetes, this once weekly rhythm brought a new kind of steadiness, a smoothing of the sharp peaks and valleys of blood glucose. It was a scientific echo, faithful to the original hormone's intent, but lasting long enough to make a meaningful difference in a chronic condition. The molecule was a masterpiece of targeted mimicry. Yet, as with any gentle echo sent into a complex space, the sound can travel in ways the sender might not initially anticipate. The very mechanisms that so elegantly managed blood sugar, the slowed gastric emptying, the amplified signal of fullness reaching the brain, began to tell another story in the bodies of those who took it. Patients and their doctors started to notice a consistent, often welcome companion effect, a gradual, steady loss of weight. The drug's primary conversation was about insulin and sugar, but its whisper to the appetite centers in the brain was being heard, loud and clear. This was not a violent suppression of hunger, not a stimulant-driven aversion to food. It was something softer, more fundamental, a restoration of the natural pause, the feeling that enough has been had, a recalibration of the set point around which the body seeks to balance its energy. The science had created a tool of remarkable precision for one purpose, and in doing so, had quietly unlocked a door to another. The molecule, in its serene and sustained presence, was found to be speaking a more universal language of metabolic balance than anyone had first supposed. And so, having marveled at its creation, we must now follow this gentle echo as it leaves the controlled environment of the lab and enters the vast, intricate landscape of the human body to see what stories it would tell there. And so, the story of this medication born in a laboratory with a very specific purpose, began an unexpected journey. It was a journey that would take it from the quiet, methodical world of diabetes management and into the bright, often chaotic spotlight of a culture deeply preoccupied with weight. This shift did not happen in a boardroom or through a marketing campaign, at least not at first. It happened quietly in the lived experiences of the people who were using it. As clinicians prescribed it for its intended purpose, they began to notice something. Their patients, while seeing improvements in their blood sugar, were also reporting something else. They spoke of a gentle distance appearing between themselves and food, a fading of what's often called food noise. That constant background static of thought about eating. Portions became smaller, not out of grim determination, but because the signal to stop simply arrived sooner and with more authority. The scale began to move steadily. What was a welcome side effect for some became for others the main event. Word of this effect began to circulate, not just in medical journals, but in conversations between friends, in online support forums, in the hushed exchanges of hope. Science, of course, had to catch up to these stories, and it did. Researchers confirmed what the anecdotal reports suggested. This class of medication, by slowing the passage of food and speaking so directly to the brain's appetite centers, could indeed lead to significant and sustained weight loss. It was a powerful validation of a biological pathway that had been waiting to be understood. With that validation, the dam broke. The medication, under the name Ozempic, and later others specifically approved for weight management, transformed almost overnight from a diabetes drug into a cultural phenomenon. It became a headline, a hashtag, a status symbol for some, and a source of desperate hope for many others. Social media feeds filled with dramatic before and after photographs, with testimonials that sounded almost miraculous. The narrative was compelling and simple. A weekly injection could quiet the ancient, often frustrating dialogue between body and appetite. It promised a kind of peace. But as with any phenomenon that moves so quickly, reality soon presented its complexities. Demand soared, far outstripping the carefully calibrated supply chains of the pharmaceutical world. Shortages began, and with them, a difficult ethical tension emerged. For people with type 2 diabetes, for whom this was not an option but a crucial tool for managing a chronic disease, finding their prescription became a monthly source of anxiety. The very medication that was granting a new ease to some was becoming dangerously elusive for others. Doctors found themselves in the position of gatekeepers, navigating between two profound needs: the need to treat a metabolic disease and the desire to alleviate the burden of obesity, which is itself a serious health condition. The conversation grew fraught, spilling over into debates about vanity, about health, about who deserves a medical treatment. It's a conversation that often lacked gentleness, reflecting our culture's own deep-seated anxieties about bodies, willpower, and control. Through all this sound and fury, the medication itself remained unchanged. A clear liquid in a pre-filled pen, doing exactly what its molecular design intended it to do. It was a mirror, reflecting back to us our collective hopes and our conflicts. The story became less about a single drug and more about our relationship with science as a solution, about the speed at which a discovery can outpace our social and ethical frameworks. It asked us quiet, uncomfortable questions. Is the goal of medicine merely to treat disease, or can it also be to alleviate human suffering, which can wear many guises? Where is the line between a healthcare tool and a lifestyle enhancement? There are no simple answers here. Only a spectrum of grays that each person, each clinician, must navigate with their own conscience. This entire chapter, from discovery to viral fame to shortage to debate, feels like watching a stone dropped into a still pond. The initial splash is the startling effectiveness of the drug, but the ripples that spread out, intersecting and colliding with one another, those are everything else. Our healthcare systems, our social media dynamics, our personal yearnings, our societal judgments. The stone is simple physics. The ripples are the human world, and as the wider rings of this phenomenon continue to spread, it becomes important to turn our gaze from the turbulent surface of the water and to look deeper, to consider what it feels like, not as a headline or a controversy, but as an experience within the living body. For every story of transformation, there is a quieter internal narrative of adjustment. The body, that wise and ancient system, is receiving a new persistent signal. And while it listens and responds, it also has things to say of its own. And as we find ourselves within this steady rhythm of a weekly injection, of watching numbers settle and habits quietly reform, it's natural to wonder about the balance of it all. The body, after all, is a master of equilibrium. Introduce a new, powerful signal, and it will adjust. It will speak in its own language of feedback. So let's sit with that idea for a while in this calm space and gently explore what that conversation might sound like. The effects, the safeguards, the body's gentle and sometimes less gentle ways of saying, "I'm adjusting." Most journeys of any significance have their moments of friction, and this one is no different. The most common are those digestive whispers. A feeling of fullness that arrives a little sooner at a meal. A subtle nausea that comes and goes like a low tide. A bout of constipation. It's helpful to think of these not as malfunctions, but as the direct, logical echo of the medicine's primary purpose. You are, quite literally, telling your brain and your stomach that you are more satisfied, that digestion can slow. The body is simply hearing the message, sometimes with a bit of surprise. For most, these sensations are mild tutors, teaching a new pace of eating, and they often soften into the background as the weeks go by, as the body learns this new, quieter language of satiety. But a deeper, more serious conversation is also part of the safety instructions that come with this medicine. There is a notable, though rare, risk that has been clearly observed and must be spoken of with quiet clarity. This involves the thyroid gland, that delicate, butterfly-shaped organ in your neck that governs so much of your metabolic tempo. In very specific animal studies, medications like Semaglutide have been linked to a type of thyroid tumor. It's important to understand the language of this warning. It was observed in rodents at exposure levels far beyond human use, and to this day, it has not been confirmed to occur in people. But the caution remains, a vigilant guardrail. This is why your doctor will ask about a personal or family history of a certain type of thyroid cancer, called medullary thyroid carcinoma. It is a precaution, a thoughtful pause before beginning, ensuring the path is clear for you specifically. It is medicine being responsibly cautious, drawing a boundary out of an abundance of care. There are other, rarer signals to be aware of, which your doctor will discuss with you in detail. The possibility of pancreatitis, an inflammation of the pancreas, which would announce itself with a severe, persistent pain in your abdomen, or changes in vision in those with diabetes, as rapid improvements in blood sugar can sometimes temporarily affect the shape of the eye's lens. And, as with any medicine that slows digestion, there is a theoretical note about a condition where the stomach empties with extreme slowness. These are the signposts along the path, not to incite fear, but to foster informed awareness, Knowing the landscape means you can recognize a true aberration from the usual minor adjustments. It allows you to be a quiet, observant partner in your own care. Yet, as our understanding of this class of medicines deepens, the conversation is expanding in remarkably hopeful directions. We began by talking about blood sugar and weight, but we are discovering that the story may be much broader, touching systems we hadn't initially considered. Imagine the medicine's effect not just as a single note, but as a soft chord that resonates through many chambers of the body. Consider the kidneys, those two diligent filtration plants in your lower back. For people with diabetes and chronic kidney disease, the strain of high blood sugar and pressure is a constant burden. Recent landmark research has shown that semaglutide can provide a profound protective effect for these vital organs. It's as if the medicine is gently taking some of the load off the filters, helping to preserve their function and dramatically reducing the risk of major kidney-related events. This isn't just about managing a number on a lab report. It's about preserving a fundamental, life-sustaining system for the long journey ahead. And the resonance may even reach the mind. The link between metabolic health and mental well-being is a complex two-way street we are only beginning to map. There are early, intriguing observations, stories from patients and initial studies, suggesting that as the body's metabolic inflammation quiets down, so too might some of the background noise of anxiety or depressive rumination. The GLP-1 receptors are present in brain regions involved in stress and reward. Could calming one system help soothe another? It's a gentle, open question on the horizon. A possibility that the benefits may ripple out into the very quality of our thoughts and feelings. Even our joints, the hinges that carry us through the world, may feel a downstream effect. Excess weight is a physical stressor, a constant load. Reducing that load logically brings mechanical relief. But there may be more to it. The same low-grade inflammation that affects metabolism can also seep into joint spaces, contributing to the ache of conditions like osteoarthritis. By addressing that root inflammatory signal, there is a hope, a scientific whisper that we might be soothing the joints from the inside out, not just lightening the load upon them. So, where does this leave us in our understanding of the balance? It leaves us with a picture that is nuanced, and in its nuance, deeply human. There is a profile of side effects, mostly mild and manageable. A lesson in listening to the body's adjustments. There are serious, carefully marked boundaries, respected out of utmost caution. And there is this emerging, almost melodic horizon of secondary benefits for the kidneys, the mind, the joints. Hints that we are tapping into a fundamental pathway of wellness. It is not a magic cure, but a powerful key. And like any key, it must be used with knowledge, with the guidance of a trusted professional who can help you listen to what your unique body is saying. It's about finding your own equilibrium within this new rhythm. And as we contemplate this balance of present reality and future promise, it's only natural for our gaze to soften and look toward what might be waiting just ahead. So, here we are, in the quiet of this moment, having traced a path through the gentle mechanism of a medication, like Ozempic. We've seen how it speaks the language of the body, a quiet conversation in the intricate network of appetite and metabolism. But stories, like science, are rarely about a single point of light. They're about constellations. And if Ozempic is one bright star in our current sky, it's worth letting our gaze soften and expand to see the whole emerging constellation of metabolic medicine. This isn't a race with a single winner, but a slow, deliberate dawning of a new understanding. So, let's talk softly about what's on the horizon. You see, the fundamental discovery that our hormonal pathways are a powerful leverage point for health has opened a door. And through that door, researchers are now walking, carrying new lanterns. Think of Ozempic as a key that fits one very important lock. But what about a key that can turn in two locks at once? That's the idea behind medications like Mounjaro, which we call a dual agonist. It engages not just one messenger, GLP-1, but a second called GIP. Imagine if our earlier metaphor of the inbox had two priority senders, GLP-1 and GIP, both sending similarly calming memos about fullness and blood sugar. Mounjaro is like ensuring both of those memos arrive, are highlighted, and are acted upon simultaneously. For many, this dual approach has shown even more profound effects on weight and glucose control. A gentle reminder that our body's chemistry is a chorus, not a solo. And the symphony may grow richer still. On the very edge of research are what scientists call triple agonists. A single medication designed to thoughtfully engage three separate hormonal pathways, GLP-1, GIP, and perhaps a third called glucagon. The goal isn't to overwhelm the system, but to orchestrate a more complete, more harmonious response. It's the difference between listening to a single beautiful instrument and hearing the entire string section swell. The early whispers from clinical trials suggest these next-generation medicines might offer a deeper, more sustained recalibration of metabolism, all from a single, weekly whisper of a dose. For some, the idea of an injection, however small and infrequent, can feel like a hurdle. And so the future is also thinking about convenience, about meeting people where they are. That's why there is a quiet push towards effective oral form of these medications, a daily pill that could achieve what the weekly injection does. It's a different rhythm, of course. A daily, gentle nudge instead of a weekly embrace. But it represents choice. And in medicine, choice is a form of respect. It acknowledges that our lives and our comforts are unique, and that the path to health should accommodate that individuality. Perhaps the most expansive and quietly hopeful frontier is where this science might travel beyond the borders of metabolism. Because the brain, as it turns out, has receptors for these very same hormonal signals. The GLP-1 pathway isn't just active in the gut and the pancreas. It's woven into the neural landscapes of reward, compulsion, and memory. Researchers are now, with great care and curiosity, asking if gently modulating this system could help soothe other forms of craving. Early studies are looking at everything from alcohol dependence to compulsive behaviors. The theory is elegant. If this pathway can quiet the insistent whisper for food, might it also soften the call of other addictive substances or behaviors? It's a profound question, suggesting that the roots of various cravings may share a common soil in our neurobiology. And the gaze stretches further towards the delicate, fog-bound realm of neurodegeneration. Conditions like Alzheimer's and Parkinson's are devastatingly complex, but a thread of research is examining the role of insulin resistance in the brain, sometimes called type 3 diabetes. The thought is that if these medications can protect and improve metabolic health in the body, might they also offer a protective, nourishing effect on the energy-starved neurons of the brain? It's early, speculative dawnlight, but it points to a future where metabolic health is seen not as a separate concern, but as a foundational pillar of our overall well-being, from our organs to our minds. All of this, the dual and triple agonists, the pills, the potential for treating addiction and protecting the brain, it can feel like a quiet revolution, not a revolution of loud proclamations, but one of deepening understanding. It's a shift from seeing weight or blood sugar as a simple fault line to be crossed, to understanding them as signals from a deep, interconnected system. The body is telling a story. For decades, we may have misheard the language. Now, we are learning to listen, to translate, and to respond with a new, more nuanced vocabulary. And so, as we let our minds wander through this hopeful future of medicine, it brings us gently back to the present and to the human heart of all this science. Because every data point in a clinical trial, every new molecule designed in a lab, every hopeful headline, it ultimately connects to a person. To the quiet relief of seeing a healthier number on a scale, to the regained ability to play with a grandchild without losing breath, to the faint, returning flicker of confidence when looking in a mirror. This science, in all its complexity, is in service of simple human stories. Stories of reclaiming a sense of agency. Stories of feeling at home in one's own body again. The horizon of medicine is bright not because of the technology itself, but because of the dawn it promises for everyday lives. It's a good moment to take a slow, deep breath and simply sit with that thought for a while. As we've journeyed through the quiet mechanics of this medication, from the cellular whispers to the body's gentle recalibration, we arrive now at a landscape that is perhaps the most familiar and yet the most complex of all. The human landscape. For beyond the molecules and the clinical trials, there exists the quiet reality of daily life, of choices made in the soft light of a doctor's office, of paperwork and pharmacy counters, of personal values whispering alongside medical advice. This is the tapestry where science is woven into the fabric of a single life, and the threads are as varied as the individuals themselves. So let's sit with this for a moment, the very practical human dimensions of a path like this. First, consider access. Think of it not as a door, but as a bridge that some can walk across with relative ease, while for others it seems to be drawn up, resting on a distant shore. The materials of this bridge are often made of things like cost and insurance and geography. The medication itself carries a significant price tag, a number that can feel abstract until it becomes a line in a monthly budget. For some, their insurance plan is a supportive partner, agreeing to share that burden, making the path forward tangible. For others, they may find themselves facing the full weight of that cost alone, which can make the bridge feel impossibly long, a journey not yet possible to undertake. And this disparity isn't a minor note. It's a profound chorus in the story of modern medicine, a reminder that the map of health is often with another map, one of economic circumstance. Then there is the quiet, ongoing conversation of lifestyle. Using a medication like this is rarely presented as a replacement, but more like a companion on a longer walk. Imagine you're learning to tend a garden. The medication might help prepare the soil, making it more receptive, but the planting, the watering, the daily care, that still comes from your own hands. The nourishing meals, the movement that feels good to your body, the sleep that restores you. These are the timeless, foundational practices. The medication becomes a tool that works in concert with them, not a substitute that lets them fall silently away. For many, this integration is the heart of the journey, a rediscovery of habits, a gentle realignment with one's own body, with the medication serving as a kind of steadying guide. And this leads us, perhaps, to the most intimate part of all, the choice. The deeply personal decision to invite this kind of intervention into your story. This isn't a choice made only with the mind, analyzing graphs and statistics. It's a choice that involves the heart, one's history, one's hopes, and sometimes one's hesitations. For one person, it might feel like a lifeline, a long-awaited key to a door they've been trying to open for years. For another, it might feel like a compromise, a necessary step on a path they wish looked different. For yet another, the very idea might not resonate at all, clashing with their personal philosophy or their body's own narrative. There is no universal right answer here, only individual truths, and these truths are often explored in the safe, confidential space of a trusted healthcare provider. A conversation about risks and benefits, yes, but also about personal goals and fears, and the simple question of whether this approach feels like it could belong in your life. We must also gently acknowledge the spectrum of stories. Some walk this path and find a profound sense of relief, a quieting of a long internal struggle, a new chapter of well-being. Others may encounter side effects that speak too loudly, making the journey feel untenable, leading them to step off the path with just as much courage as it took to step on. And many, perhaps most, are somewhere in the gentle middle, navigating the ordinary adjustments, noticing subtle shifts, learning the unique language of their own body's response. All of these stories are valid. All are part of the larger human picture. It's important to remember that this isn't a race with a clear finish line. It's It's more like a pilgrimage, a personal walk where the destination isn't simply a number on a scale, but a broader sense of health, of autonomy, of peace. Some may walk this path for a season, others for a longer stretch of the road. The direction is always guided by that ongoing, quiet dialogue between a person, their body, and their care. So as we reflect on this human tapestry, woven with threads of access, daily practice, and personal choice, we see that the story of a medication is never just about the science contained in a vial. It's about the homes it enters, the hopes it carries, the practical realities it must navigate. It's a reminder that health is a deeply personal landscape, and each of us holds the map to our own territory, consulting with guides we trust, choosing the paths that feel right for our journey. And with that understanding held gently in our minds, we can begin to draw our reflections to a close, seeing how all these threads of biology, of society, and of self are intricately connected. And so, as the quiet deepens, we come to the end of this gentle exploration. This modern story of a hormone, repurposed, and of a single molecule that found itself at the very center of a cultural conversation. It's a story that began in the intricate language of our own bodies, in the whispers of the gut and the pancreas, and it rippled outward to touch medicine cabinets and dinner table discussions, and the quiet hopes of millions. What we've traced tonight is not a story of magic, but one of understanding, a deliberate, careful chapter in the long human effort to listen to our own biology and to respond with compassion and science. Ozempic, in all its complexity, is simply one recent word in that enduring story. Think of it like a single, clearly defined star in a vast and ancient constellation of health. For so long, we could only see the broader patterns, the challenges of weight, of metabolism, of hunger itself. Now, we've begun to map one specific point of light to understand its nature and its potential to guide. It is a tool, not a destination. Its true meaning will always be written by the individual lives it touches, the conversations between patient and doctor, the personal journeys undertaken in hope of greater well-being. So as this chapter closes for now, let it be a reminder of the quiet marvel of our own being, the fact that a subtle signal within us can be understood and gently met is a profound kind of magic all its own. This is simply how the story of human health unfolds, not with a shout, but with a series of soft, persistent discoveries, each one building a gentler, more understanding world. And with that thought, we can let the story settle, feeling no need to solve its puzzles tonight, but simply to acknowledge its place in the quiet continuum of care. Let your mind rest now, knowing the story continues peacefully elsewhere. Sleep well.